annexing blockchain for secure and accessible healthcare in Africa. So before I start, we have a lot of challenges in the healthcare system in Africa, like a whole lot of challenges. And what is the reality that have hit us in the healthcare system in Africa? We have record lost between hospitals. Sometimes you go to the hospital and you hear something like, I can't find. Can you hear me?
Yeah.
Sometimes you go to the hospital and you hear something like, I can't find your data, we can't find your record. You get, sometimes you go to the pharmacy store, maybe the local one around your area, and you get something like, this drug is expired. Sometimes you go to the hospital and you want to use your insurance and you get delay, like you get you get things like, no, your insurance have not been activated, you have to wait for 3 months, no, your insurance does not cover this. Like, you yourself as a patient, you don't even have access to it, you don't even know what your insurance entails. We have patients that is excluded from their data, that does not know anything about their data, that does not even have access to their data. So this is why we have blockchain, to help us solve this problem in the healthcare system, especially in Africa. Are we following me? So, what is blockchain? Can you hear me?
Yes, perfectly.
Yeah. What is blockchain? I know a lot of us might be like, okay, I've heard about blockchain. It's cryptocurrency. It's not only cryptocurrency that they're doing. No, blockchain is actually beyond that. Blockchain technology is an advanced database mechanism that allows transparent information sharing within a network. Let me give you an example of what blockchain is, in case we don't understand. So imagine you have your own data, you have your own record yourself, and it is like a shared notebook, and you are the only one that have access to that data. You can decide that, okay, you have the data in hospital A, and you know everything that is on the data, and that data, everything is stored on blockchain, right? And you travel to US, you can get access to that data and send that same data to US, that, okay, this is my record, this is what it entails when it comes to my health status and all. Trust me, when those people check it, they can't erase it, because it's your own data, it's decentralized. No one can erase it or change anything in the data, but they can see it, right? Everyone can see it, everyone can have access to it, but no one can touch the data or do anything to the data. And that is the problem we have now, because some of the healthcare systems don't use blockchain. And when you get your data, you feel they can do anything to it. You can go for your genotype now and get that, okay, you are AA. By the time you check later, maybe your data has been missing or some mistake, error, and you see AS. No, I am AA. How come this is happening? You get, the solution is blockchain. Blockchain will help us solve this problem, whereby everyone have access to their own data. That is why it's an advanced database mechanism that allows transparent information sharing within a network. So why does blockchain matters in healthcare? Like, some of us will be curious and be asking, why does blockchain matters? Like, why blockchain? Why are we hammering on blockchain? Let me give you a story. There was a time that one of my friends went to the hospital, I think during my NYC days. So one of my friends went to the hospital for a test. He wanted to do his genotype test. I don't know if he has joined the call. So he wanted to do the genotype test, and he went to the hospital. They took his blood. The next thing they said is, okay, come back the next day to check your results. So he went back the next day, and he had something like, we can't find your your results, we can't find your data, we can't find it, we can't do that. And he was like, well, I came yesterday and you took my blood, you took my sample, like, why are you saying this? They begged him, and they told him that, okay, can we just take your blood sample again? He allowed them. He came back home and he told us that, imagine what these people did. They were telling me that they can't find my data, they can't find my sample. This is wrong. I'm tired, I'm frustrated. Even though that I need these results and this test result, I will not go back. So I think the fourth day he went back to the hospital. Same thing. Like he was just confused that what's going on. He had to leave the hospital. That you are not going to take any blood sample again. He had to go and meet a doctor that is working in the hospital that he knows and explain to him. So the doctor had to beg him that please just wait behind. We'll sort this out. And they took his blood sample again before he could get his results. You see this issue, like it's not supposed to be so. Imagine the person made the result for something crucial, something urgent, for something that can actually save a life. This is what will happen. Okay, you can't find the result, you can't find data record, you don't know where it is, you can't find the blood sample. That is why blockchain matters in healthcare, because with blockchain, all this thing will not be happening. You will not be hearing stories like we can't find your blood sample, your result is missing, your file is missing. These are real problems we are facing, and they cost life. They actually what they cost life. There is no trust, there is no transparency in healthcare. And this is where blockchain comes in. This is where blockchain matters. Number one, it protects data integrity. It empowers patients, like it gives you control over your record. Like I've said the other time when I was designing blockchain, it tracks medicine and supply before the medicine gets to the pharmaceutical supply chain.
One of our
Like,
fellows don't share why blockchain matters in healthcare. Why?
hello,
Blockchain
can,
matters.
can you hear me? Hello, can you hear me?
Yes, we can hear you. Actually, someone just entered, and that's why her mic was muted.
Oh, okay. So there's nothing like counterfeit drugs. There's nothing like you don't you there are unlawful tax. Like there's nothing like you don't have access to anything that concerns you, that concerns your data. There's nothing like fake medicine. There's nothing like insurance. Your insurance, you go to the hospital and you can't find your record, they tell you to come back, you wait for so long. No. This is why blockchain is coming into the system. So now let's explain more better so that we can understand how blockchain can change the narrative in the healthcare. So patient record that travels with you. I said something the other time. I said when it comes to blockchain, you have access and ownership to your own data. Like the data is for you. Imagine you do your test in Lagos State and you travel to London, right? And your test result and everything is stored online on blockchain and you have access to it. You can like it's stored safely. Nothing will happen to it. Nobody can erase it. Once it is stored for life. So you can actually take that results because it's online. You can show them in London that okay, this is it. Blockchain make it possible. There's nothing like lost files, repeated tests. Patients become the true owner of their own data. That is one thing blockchain does. You decide who see your data. It work across hospital. One record for life, nothing like duplicate record. One record stored online, stored on blockchain for life. Then drugs and medicine are traceable. There's nothing like okay, you can track the drugs in the that is being given to you. One thing we don't understand is fake medicine. It kills more than diseases. Like some people have different diseases, no, but some people are okay, but they are taking fake medicine. It kills more because you don't know how this thing is being preserved. You don't know how they make it. You don't even know anything about it. That is why blockchain is here to help us. Blockchain can tag every batch of those medicine at the factory and record each movement until it reaches the pharmacy. Like it will tag it, there will be a tag on it, right? Until it reaches the pharmacy. So if someone tries to sell a fake drugs for you, it immediately flag it. Like there's a flag. It's given that this medicine it's fake. So it is just like its own digital passports. Like okay, you bought this drug and you can see the sign on it. Okay, this thing you can check it if it's actually the drug is safe for you to use or is not safe, right? So it's this thing build trust. When we make use of blockchain, it build trust. People begin to trust us in the healthcare system more, and it exposes people that actually make fake drugs. Another thing is insurance make easy, like it makes insurance easy. In some area, people have been treated by fake doctors. People have been, a lot of things have happened. Some people, we call them auxiliary nurse, right? If we make use of blockchain, it will show, it will verify all the healthcare system data. Anybody that is working in the hospital, if the healthcare system, if the data is verified by blockchain, it's stored permanently. So whenever you visit a hospital, you can actually check if the doctor is verified, if the qualification is on blockchain. It will verify them instantly that okay, this patient is actually, this doctor is actually a legit one. No, it's build trust and honest in the in medical profession. And when we talk about insurance, you know that many of us, when we go to the hospital, we wait for so long. It has happened to me too before. Like I go to the hospital, I'll wait to verify my insurance before I can see the doctor. With blockchain, you can make use of smart contracts, which can automatically confirm a treatment and release payment immediately. Nothing like, okay, you have to meet this person in charge of record. You have to queue for a long period of time. No, it is fair and fast. It make everything easier for us. Another thing blockchain does is it give you access to everything you want to do. Everything, anything you want to do in the healthcare space, it give you access to it. So what are the challenges that need to be solved in order for us to actually make use of this blockchain? Because there are challenges, right? And if these challenges are not being solved, it will not be easier for us to implement the use of blockchain system in healthcare. One of it is internet and power supply. Like we want to make use of blockchain, right? We want to use it in healthcare system in Africa, but then we have different issues in Africa, in the sense that sometimes you might be doing something and there's power failure. Sometimes the internet, like now, rain is falling, right? And the network started from Twitter. I was like, God, what will I do? No, I have to change to another network so that I can be able to come here. That's part of it. So every solution comes with challenges, actually. So we still face little challenges with pure connectivity, high costs of new system, lack of training, policy, and data privacy. But all these things that I mentioned, they are not impossible for us to actually solve. They are not impossible. We just need collaboration and more people to help us solve this problem. We need professionals, we need stakeholders coming together and say, okay, these are things that we know that might affect what we want to implement. How can we solve this? What do we do? Do we need to train more people in the to know how to use blockchain? Do we need the techies to come on board to do so things? Do we need to invite people in the earth space? Like we just need to come together and actually collaboration, actually come together and make sure that okay, this thing works. It works. And when we check, I don't know if you check, there are some African healthcare that have been making use of blockchain. If you check My Clinic in South Africa, they make use of blockchain for their patient data. My Clinic. We have Mediledger. You can go and read about them later. This Mediledger, they actually track medicine for supply chain, like they track medicine. We have some startup in Africa, but for Nigeria, we have, I believe we have started implementing blockchain. It might not be fully, but it's a gradual process, and which I believe before 2030, blockchain will come fully into the system. So what is the way forward? The way forward is we start small, one step at a time. Like one step at a time. We take it slowly. Okay, we are starting from hospital A. Maybe we are starting from Lagos and Ogun State. Okay, Lagos and Ogun State, we are implementing blockchain. We are training workers and policymakers. We are training people to know more about blockchain. We are training developers. We are doing this, we are doing that, so that healthcare can be accessible, so that we can move the healthcare sector in Africa forward. That's where to start from. Like, we are not just rushing it, we are starting. So we are also building partnership, like governments coming together, the health leaders coming together, the techies coming together, the blockchain professionals coming together, making sure that things work. Because this thing is actually a collaborative effort. So if we are not ready to come together to do this thing, it will definitely not work. So if government officials are coming together, the blockchain professionals are coming together, everyone, you and me, we come together to make it work. We create strong data protection for law. So we must start small. The key way to move this thing forward is collaboration, coming together with health experts, government, technologies, and by that, the healthcare system will move forward. So our shared vision for Africa healthcare is secure, transparency, and accessible to all. I know some of my National Health Fellows are here. Thank you so much for joining. One thing we do in National Health Fellow is we make sure that healthcare, our goal, our vision is that healthcare is accessible to all, is secure, is transparent, and what's accessible to all. So with the use of blockchain, with the help of blockchain, we can actually achieve this. We can achieve trust, transparency. Healthcare is secure. Everyone have access to healthcare. There's nothing like delay. There's nothing like missing record. There's nothing like you get to the hospital and you start waiting for you to verify your insurance. Nothing like that. With blockchain, we can achieve all this. Blockchain is not just a technology. It is a tool to rebuild trust in Africa. So if you're not taking anything home, I want you to remember that blockchain is not just a technology. It is a tool to rebuild trust in healthcare, especially in Africa. I hope we learned something